Hello, everybody. Hope everybody's doing well. My name is Christiane, and I'm an exercise therapist with Simply Health Solutions. And today we're going to be talking about one exercise I really encourage people to do on a regular basis, which is the front lunge. And today I'm going to be talking about how it helps, how to complete a typical front lunge, and a couple of modifications depending on your current strength and your current ability to maintain balance. Now, whenever it comes to any new exercise program, always make sure you're checking with your doctor or an exercise professional because you do want to make sure that there aren't anything in your medical history that is going to prevent you from being able to do these safely. So when it comes to a front lunge, I always think about it in a couple of different ways as to why it is so helpful. And the first one is stability. And it's just that idea of maintaining your balance while putting your weight on one leg and then the other leg and kind of shifting your movements around. It's really important for balance because when we're walking, we are not always putting all of our weight on both legs. We are basically doing a very simplified version of a lunge. We're taking a step forward, we're putting weight on that leg, and then we swing out the other leg. So in that sense, I really do like the lunge because it has that kind of balance component to it, which I find a lot of people really do benefit from that stability training. The other thing is symmetry. So, what often happens is, for whatever reason, we tend to favor one side of our bodies over the other. Now, maybe you're somebody like me who has had an injury to one side of the body. So, even I've noticed that I have a tendency to favor my uninjured side more than my injured side. And even I'm trying to be cognizant of that and making sure I'm not always putting more weight on one side than the other. And this could arise from a variety of different reasons. Maybe you've got some arthritis in one joint. Maybe you've had a hip or knee replacement. Maybe you've had a stroke. Maybe you've had a number of different medical injuries. Or again, kind of just maybe preference. You've just always kind of used your more dominant side, haven't really thought about using your weaker side. So, what ends up happening over time is that side that's not getting used very much becomes weaker. And that really throws us off when we're trying to walk or maintain our balance because we feel fine as long as we're on our stronger side. The second we go onto our weaker side, it kind of really throws everything off. And then you have flexibility. You'd be surprised how much flexibility is actually involved in doing a lunge. We often think of it mainly as a strengthening exercise, but if you don't have enough flexibility in your hips, in your back, in your knees, or your ankles, you'd be surprised how much you might actually struggle to do a lunge in the first place. And one of the most important reasons why I bring up lunges in a lot of my different programs and with the different clients that I work with is because of independence. So a lot of people that I work with who are seniors, they worry very much about falling to the ground and not being able to get back up. One way that I often recommend, as long as you've done your checks and you're making sure you haven't hurt yourself, is if you're going to try to get up from the ground, is by getting on all fours, getting to a place of safety. So whether that's a table, a chair, a counter, something that's going to be stable, and then basically doing a lunge to get yourself back up from the ground. So I actually find it helpful not only for the strength and the stability and those aspects to it, but ultimately for independence. Because if you can manage to do a lunge from the ground down and back up, then you're going to have a much easier chance to get up from the ground if you were to ever fall down to the ground, or if you just wanted to get down to the ground, maybe to do a floor-based exercise or get down to the ground to maybe, clean under your couch or look for something that's rolled under your fridge. It's just that ability to being able to come back down and come back up using just the one leg. Now, when it comes to how to complete a front lunge, Essentially, what you do is you're going to stand up nice and tall and you're going to take a step forward. For some people, that might be a very large step. For some people, it might be a very small step. It's just that idea of you take a step forward and then you put weight onto that leg, you slightly bend, and then you come down. For some people, if you are a little bit you're kind of struggling with your balance, it's important to have either a counter, a chair, a table, something nearby for stability in case you lose your balance. Me, as a kid, I injured my ankles a lot as a kid. So even my ankle stability is kind of wonky. So I sometimes struggle doing a lunge just because of my ankle stability. So even I, every once in a while, like to have something nearby just because I can be a little bit wonky too. So it is important to keep in mind your own limitations. One thing that a lot of people talk about is kind of that foot position, especially that front foot position. To me, the most important thing is nice and lined up so that your hip, your knee, and your foot are all kind of in a nice little lineup. But the other thing is try to keep that front ankle down on the ground as much as possible. Because if you lift that ankle slightly, you'll notice your knee tends not to like that very much. So you do want to try to keep that ankle or that front ankle down as much as possible. That ankle in the back is going to have to bend, as you can see in this picture. It is going to have to bend so that you can actually achieve the movement necessary. Now, when it comes to modifications, there's a ton of different modifications out there. I just picked out a few that range from easy, making it a little bit easier to making it a little harder. So the first thing is I've had clients who struggle to take that step forward where their balance is actually so unstable at this point that even just taking that step forward is actually really, really challenging for them. So, what I often recommend is don't even have that step forward. Just have both your feet planted, however far of a distance you want. The further they are, the harder the exercise is going to be up to a certain point because you want to make sure they don't slide off. You do also want to make sure you're on a nice non-slippery surface. So whether it's carpet, tile, make sure you're wearing proper shoes, but you want to make sure you got a good grip on the ground. But in this case, what you can do is just have your 2 feet, one out in front of the other, and then you can just sway from side to side. So having all the weight on one leg and then all the weight on the other leg. Again, it's just that idea of thinking about that symmetry. And then even just see, does one leg feel significantly stronger than the other, or do they feel about the same? Another thing that you could do, especially if you are trying to get down all the way down to the ground, is maybe have some cushioning, maybe at the beginning. Especially if you've got some arthritis or you've got sore knees, you want to make sure that it is going to feel comfortable. And especially if you're kind of coming down on wood flooring or tile, if you're doing this in the kitchen, maybe put down a cushion and maybe even a couple of cushions just to kind of give you a little bit of room. But it's just that idea of it allows you to come down slowly with confidence and protect your knee and feel comfortable. Because at the end of the day, whenever you do an exercise, you might feel a little bit uncomfortable, but it should never feel painful. And like no sharp pains, dizziness, all that sort of stuff. That's when you talk to your doctor if you're feeling any sort of those negative symptoms. Do reach out to either your doctor or an exercise professional. Now, if you're getting really good at it, you can maybe hold on to a weight while you're doing those exercises. So, that idea of you could use a free weight. So, something you can pick up, kind of at a Canadian Tire or any kind of sporting goods store or any kind of, usually most department stores have them. You can kind of grab a weight or Depending on your fitness level, maybe look around your house and just see if there's anything around your house that you can take a hold of and just hold on to it while you're doing your lunges. You're going to notice that if you only have the weight on in one hand, it actually is a little bit harder and it's a little bit trickier, which depending on your fitness level might actually be something you're looking for and might be something you actually want to be doing. Lastly, is if you're really getting good at it, maybe try going onto an unstable surface. Doesn't have to be something as fancy, as this piece of equipment known as a Bosu ball, but just something. It could be a cushion, it could be, a balance disc that, again, you can kinda pick up at any department store, or just anything that you find is a little bit, not a very solid surface, but a little bit squishy, because that will just cause your body to realize that it's like, okay, this is not totally stable. And your body's going to have to practice maintaining stability on an unstable surface. And that's really important because sometimes, maybe if you want to take a walk out in the park, that's not always going to be a stable surface. Or maybe you're walking down the street and maybe there's been some construction. Maybe the roads are kind of uneven. That's going to be something to consider. And just being able to go out and not be worried about things like an unstable surface or an uneven surface. So, making sure we are trying to challenge ourselves in any way that kind of makes sense to you. At the end of the day, exercise should be something you enjoy, something you like doing. Um, and I really recommend the front lunges because it's just so good for your independence and so good for active aging. I always say, with practice, you'd be really, really surprised what you can achieve. I've worked with so many different people, and I've had so many people surprise me and their doctors with their dedication and their willingness to try and their ability to just keep going despite kind of maybe feeling a little bit discouraged about their current situation. Um, You'd be surprised. I always say, give it a try. Um, the risks of exercise are definitely going to be less than the risks of not exercising. If you do want additional support, feel free to reach out and we could always have a virtual appointment. Maybe we can kind of talk about how to best modify a front lunge for you, how to maybe think about using different things in your home or in your community, maybe in your local gym that you have access to, and how to use those in the best ways to keep yourself active. Feel free to email me if you have any questions. Feel free to check out my website. Do subscribe to my YouTube channel for more information, and I hope to see you next time. Thanks. Bye.